joining me for what I hope you'll find an interesting and thought-provoking session, looking at the value of veterinary nurses, and in particular the value of their time to veterinary practice, both in terms of the care they provide for our patients and the support that they give their colleagues, as well as the financial value in terms of the income they generate. So I'm going to start with a question for you, and it's not one to be answered by a poll or anything like that, it's just something to make you think. How much do you feel that clients appreciate what veterinary nurses do in a veterinary practice? And how much do you think they value it? And I'm just going to let you think about that for a few seconds. So I think the words appreciate and value are similar, but they're subtly different. Appreciate perhaps has more of an emotional feeling to it, and I suspect that quite a lot of clients do appreciate what veterinary nurses do because they presume they're the people who, shall we say, look after their pet when it's hospitalised. Veterinary nurses make sure their pet is comfortable in its cage before and after surgery, or if it's hospitalised because it's unwell, that it's fed, watered, taken out, or its litter tray dealt with and provided with clean bedding. So it's all about that feeling that veterinary nurses really care for their pet, maybe in a sort of Florence Nightingale type fashion. Value, on the other hand, sounds a little bit more as if it's something to do with finances or money. And I have a feeling that sadly, clients may not necessarily consider that veterinary nurses have value in the financial sense of the word. But why might that be? Well, perhaps it's because many clients simply have no understanding of the reality of what veterinary nurses do in our practices, the extensive training they undertake, and the knowledge that they have. And there may be lots of reasons for this, but I do think that it's partly due to the fact that the vital work that veterinary nurses do is often not visible to our clients. And that may well be compounded by what seems to be becoming a standard protocol in practices nowadays, being that animals are taken away from their owners out the back, shall we say, for blood sampling or other procedures, which means that clients simply never see veterinary nurses in action. So that brings me very nicely to one of my favourite subjects, veterinary nurse-run consulting services. So why do I think this is such an important area to consider when we're talking about the value of veterinary nurses to practices? Well, logically to me it makes sense. If we're looking at how we can increase the visibility of veterinary nurses to the public, putting them in obviously customer-facing roles does that. And then if those roles are ones that carry an air of authority, that should result in a greater appreciation of the professional status of veterinary nurses, enhancing their value in the eyes of the public. And consultations have the potential to do that because people consider consultants to be trusted professionals that they would visit for a service or advice that they believe they're capable of providing. In fact, the definition of the word consultant is someone who provides professional advice to others. And we used ourselves to go to consult with various professionals, such as lawyers, doctors, physiotherapists, or a human nurse. So why not a veterinary nurse? Now, I'm not in any way devaluing the work that veterinary nurses do in the back of house areas, and we will look at that a bit later. What I am suggesting is that we can rethink how we run the consulting services in our practices. And there are a lot of places where it makes sense to involve veterinary nurses in terms of helping manage the workload, as well as the potential positive financial impact. And whilst I don't think that the veterinary profession should necessarily always try to follow what our medical colleagues do, it is worth remembering that it's quite normal in human healthcare for patients to see a human nurse for regular checkups, vaccinations, screening checks, and with the advent of the practitioner nurses in doctors' surgeries, even for an assessment for an urgent appointment nowadays. And we don't question that because we're having a consultation with a professional, qualified person that society has told us we can trust and respect. So before we consider the various consultations that veterinary nurses could be involved with, I ought to just clarify a few points and provide some context applicable to the rest of the presentation. So firstly, I must apologise that as a small animal practitioner, I'm only talking about small animal practice today. And secondly, it's important that we're aware of the legislation that affects us. Now, I don't have time in this webinar to look in detail at that, but we must remember that the Veterinary Surgeons Act makes it unlawful for anyone other than a registered veterinary surgeon and member of the Royal College of Veterinary Surgeons to practice veterinary surgery in the UK.